the panel discussions, and all outputs from this conference, the declaration will be available to all of you who have attended, but also you can be able to share this widely. We will share the link on the school website where you can access all proceedings of the conference to ensure that this discussion does not stop here. So please be notified about that. And some of you are interested in getting certificates. You'll also be able to request for that and receive one. Thank you. So now I want to announce how we're going to proceed with this ceremony. We have limited time, but we are going to start with the conference declaration, which will be read to us by Dr. David Musoke, who is the co-chair of the conference organizing committee. After the declaration, we'll have a set of remarks. We'll have remarks from a CSO representative. We have Dr. Lydia Mungerera, who is with us, so she will give remarks. We'll also have remarks from the principal, Makerere University College of Health Sciences, who is represented by the Dean, Makerere University School of Public Health, Professor Roda Wanyenze. So she will also be able to speak to us. We'll also have remarks by the representative of the Director General of Health Services, Ministry of Health, Dr. Stavia Turiahawe, who is representing him. And we'll also have remarks by our chief guest and closing in that order. So without any further ado, I want to take the opportunity to invite Dr. David Musoke to come and read for us the conference declaration.
Thank you very much, Dr. Ndejo, the PS Minister of Health, our Dean School of Public Health, all delegates from various institutions, all protocol observed. My task this evening is to read out the declaration following the 5 days we've held at this conference, and I should assure you that you'll have access to this document even beyond this closing ceremony. So this is the Kampala Declaration of the National Annual Communicable and Non-Communicable Diseases Conference, as well as the 19th Joint Annual Scientific Conference, which has taken place from the 3rd to the 7th of November this year, here at Munyonyo Commonwealth Peak Resort Hotel in Kampala. Just to go through briefly the preamble, and it reads, we, the delegates of the National Annual Communicable and Non-Communicable Diseases, as well as the 19th Joint Annual Scientific Conference, comprising representatives from the central government, Ministry of Health, academia, civil society, local governments, private sector, development partners, professional associations, and communities. Aware of Uganda's dual disease burden, the persistent high prevalence of communicable diseases such as malaria, HIV, stroke, AIDS, tuberculosis, and neglected tropical diseases, alongside the growing rise of non-communicable diseases, including hypertension, diabetes, cancer, mental health disorders, and chronic respiratory illnesses. Noting that biological, social, that is poverty and malnutrition, and clinical interactions between communicable and non-communicable diseases, which compete for limited resources in fragile, verticalized health systems, thereby highlighting the urgent need for integrated, resilient, and people-centered health systems. Recognizing the additional threats posed by antimicrobial resistance, climate-sensitive diseases, zoonotic spillovers, and emergency outbreaks such as Ebola, COVID-19, and Marburg. Affirming Uganda's commitment to universal health coverage, the Africa CDC's new public health order, the Sustainable Development Goals, and the international health regulations, as well as the International Covenant on Economic, Social, and Cultural Rights, and the Global Health Security Agenda. Highlighting that the integration of health services at health facilities continues to face challenges due to high patient-to-health worker ratios and inadequate infrastructure, which impede the delivery of comprehensive, timely, and quality healthcare services. Emphasizing the need to involve all stakeholders, including from education, agriculture, environment, engineering, urban planning, gender, as well as community and religious leaders, and others in the fight against communicable and non-communicable diseases. Acknowledging with concern the persistent challenges in access to healthcare across the country due to delays in diagnosis and treatment seeking, and emphasizing the urgent need to strengthen early detection, ensure timely access to quality healthcare, and enhance community awareness about prompt medical attention. Also noting that the protection and promotion of health human rights are fundamental to ensuring health, dignity, and well-being for all citizens, as these rights form the foundation of equitable access to quality healthcare services. Highlighting the global threat of antimicrobial resistance, now causing an estimated 700,000 deaths annually, and recognizing its strong link to self-medication, poor diagnostic capacity, and weak public health interventions. Cognizant that health policies and investments have focused more on curative than preventive care, underscoring the need to reinstate a strong prevention-oriented approach. Aware that many Ugandans remain inadequately informed about health issues affecting them and their role in promoting health within their communities. And also recognizing that rapid industrialization, urbanization, and lifestyle changes are significantly contributing to the rising burden of non-communicable diseases. We hereby adopt this declaration as a shared call to action, a platform for sustained collaboration, and a blueprint for strengthening integrated and equitable health systems. We therefore commit to the following priorities. The first is multi-sectoral collaboration and One Health approach. And we affirm the whole society and whole of government approach to accelerate disease prevention, health promotion, and self-care through evidence-based awareness. Ensure all sectors of government actively contribute to advancing disease prevention and creating an enabling environment for service delivery, such as engagement of environment, agriculture, water, education, urban planning, housing, works, and finance sectors. We commit to district-led programming to strengthen local government structures for disease prevention through enforcement of the Public Health Amendment Act, as well as ensure local governments, refugee and host communities, traditional and faith-based leaders strengthen epidemic preparedness and promote health equity. We also call for stronger coordination mechanisms under the Office of the Prime Minister to enhance joint planning, accountability, and resource sharing across ministries and districts, as well as to strengthen engagement with the private sector through public-private partnerships to advance road safety, integrated service delivery, and domestic financing for health. The next call is to ensure integrated people-centered disease prevention and care. And here we affirm the urgent need to focus on people, not diseases, using a life course approach and strengthening integrated service delivery across communicable and non-communicable diseases at all levels, as well as support harmonization of clinical, diagnostic, and surveillance systems for effective co-management of overlapping disease conditions such as HIV, diabetes, TB, silicosis, as well as malaria and hypertension. We also commit to promote the use of digital tools, community platforms, and mobile health innovations to expand access, especially in underserved rural and urban areas, and also integrate comprehensive health services for communicable and non-communicable diseases, ensuring equitable access to care for all. We also request for investment in prevention first strategies, including screening, immunization, and community interventions that empower individuals, families, and community health structures, including community health extension workers, village health teams, CSOs, as well as political, cultural, and religious leaders. ensure meaningful community participation in the design, monitoring, and evaluation of integrated services, keeping people at the center of every decision, accountability process, and reform towards a resilient Uganda. The other is strengthen data, research, and translation, and recognize the importance of timely, interpolable, and disaggregated data to inform policy, financing, and implementation decisions. We also commit to collaboration between Makerere University, Mbarara University of Science and Technology, and other academic institutions, policymakers, CSOs, community influencers, to bridge the gap between research and practice, as well as to support the institutionalization of the national annual communicable and non-communicable conference, together with the joint annual scientific health conference, as regular national platforms for knowledge sharing, policy dialogue, and cross-sector learning. We also commit to translating research into policy and action, ensuring that evidence directly informs planning, budgeting, and service delivery. In terms of financing, we commit to advance for increased domestic financing to progressively reduce dependence on external aid, ensuring predictable and sustainable resources for integrated disease prevention and care, as well as to promote efficiency and accountability in health spending by strengthening budget tracking, performance-based financing, and public financial management systems, and also to support innovative financial mechanisms, including public-private partnerships, social health insurance, and community-based financing schemes to expand coverage and affordability. We therefore call upon stakeholders, and these are the stakeholders we have identified. The first is Government of Uganda and the Ministry of Health, and here we call upon acceleration, accelerate implementation of integrated strategic plans for both communicable and non-communicable diseases, as well as epidemic preparedness and a unified health systems approach, to institutionalize these conferences as the official annual integrated national health platform for disease dialogue and innovation, collated by the Ministry of Health and academic institutions. Mobilize domestic and international financing to strengthen primary health care, laboratory networks, and community systems, and also to enforce laws and policies aimed at preventing and controlling substance abuse across the country. We also call to increase the health budget sector to 15% in line with the Abuja Declaration, as well as to recruit and retain more health workers to improve the patient to provider ratio, and also to operationalize the multi-sector collaboration mechanisms under the Office of the Prime Minister to align national and district priorities for health, climate resilience, and One Health. The next is to operationalize the National Health Insurance Scheme to guarantee equitable access to quality care, financial protection, and reduced out-of-pocket expenditures for all Ugandans. We also call the government to leverage blended financing models, combining public, private, and donor resources to fund infrastructure, human resources, and digital health innovations for sustainable impact. And lastly, for the government to ensure timely and adequate resource flow to local governments, enabling effective implementation of these district-led health initiatives and emergency preparedness. To academia and research institutions, the call is to generate policy-relevant evidence and drive innovation in diagnostics, surveillance, and culturally appropriate care. Establish multidisciplinary working groups to connect research, clinical practice, and policy. Train health professionals in integrated, competency-based, and future-ready approaches. Create innovation hubs and partnerships linking academia, communities, and industry to co-develop scalable people-centered solutions. Leverage technology and innovation to effectively address communicable and non-communicable diseases, for example, through Mbarara University's digital health and surveillance initiatives. Prioritize local-led research focused on Uganda's health realities, including non-communicable diseases, communicable diseases, mental health, and climate-linked risks. To development partners and donors, the call is to align technical and financial support with Uganda's integrated disease control priorities, support the development of a national research agenda driven by local health needs, strengthen health system resilience, digital transformation, and community-led interventions. And lastly, under this category, promote regional knowledge sharing, South-to-South collaboration, and local manufacturing of diagnostics and medicines. To the private sector and civil society, the call is to engage in public-private partnerships to expand access to diagnostics, care, and innovation, champion community-responsive models for disease prevention, rehabilitation, and continuity of care, strengthen advocacy, accountability, and public education through multimedia and grassroots platforms, and also to raise public awareness on mental health, sickle cell disease, asthma, and diabetes, integrating these services into primary care and reducing stigma and discrimination. So the conference outcomes, finally, we endorse the development and dissemination of a national integrated disease control strategy informed by best practices and policy dialogues from this conference, a multi-sectoral action framework guiding collaboration among health, education, agriculture, environment, and finance sectors, a monitoring mechanism to track implementation and institutionalize annual reporting on disease integration, and lastly, to the continuation of these conferences to sustain the momentum that we've seen this week. So in conclusion, we, the participants of the National Annual Communicable and Non-Communicable Diseases, as well as the 19th Joint Annual Scientific Health Conference 2025, reaffirm our shared commitment to address Uganda's complex disease burden through unified, integrated, and inclusive action. We call upon all stakeholders, including the government, partners, academia, civil society, and communities, to sustain this momentum, mobilize resources, and collaborate across disciplines to build a healthier, more resilient, and equitable Uganda for all. And this is adopted on this day, the 7th of November, 2025, here at Speak Resort Munyonyo, for God and my country.
And so we commit. We pray for strength and wisdom to be able to achieve these very important commitments. So thank you very much, Dr. David Msoke, co-chair of the conference organizing committee. I also want to take the opportunity to acknowledge the rapporteurs who have contributed to this statement. They have been in each of the rooms trying to note down a lot of important discussions and deliberations, and have been able to do this in quite record time. So thank you. Most of them are our students from the university. We appreciate your support with this.
Could you allow one or two comments on that statement from the audience, if they do?
I also want to acknowledge a number of colleagues who have contributed to drafting this statement. I know John Robert Ekapu was instrumental, Dr. Alex Mulindwa, Dr. Christopher, and several others who have contributed to it. Thank you so much. So I'll just check in for one or two comments on the statement before we can proceed with the remarks. Maybe one or two people have some burning input that they want to make so that we can enrich this statement and it can reflect the true commitment of all of us who have been part of this conference. Anyone or two? Okay. I see Professor Francis Omaswa here. Please provide him the mic, and then we'll get, who else? I need someone from this side. Okay, I see a gentleman there, and him, and those will be the three comments we will be able to accommodate. Professor Maswa, please.
Thank you very much. A comprehensive declaration, a bit long, though could be sharper. I think you consider shortening it, especially if we want to circulate it to other people to read and implement it with us. The one point which I thought we could be stronger on, it's referred to at the end in the conclusion, but I would like us to be louder on our commitment to be leaders in the achievement of all this. I tried to make that statement when I spoke, but I would like to see it appear more boldly on the document. Until that happens, very little is going to change.
Thank you very much, Prof, for that input. Next. Can I have the mic move this side? Yes.
Okay, thank you very much. In line with what Professor has also said, I would also wish to see the aspects of the gender lens magnified a little more, because I really see they affect most of our disease interventions. Thank you.
Thank you very much, and for keeping it very brief. The last one, the last comment was from someone there. Yes.
Thank you so much. Simon Ayeva is my name, from civil society. And my ask is just one item here, where I would like to see our partnership, civil society and government, growing day by day in terms of coordination, planning, including funding. As we have all learned that the donors are pulling away, how is government ready to support us to sustain our gains, which are already in existing? We have a lot of fear when we look at TB and malaria and HIV. What has been invested by our donors is all crumbling. But how is government positioned to work together with us as civil society to ensure that we sustain these gains, either to create a one basket for funding where we can all leverage? Thank you. I submit.
Thank you very much. And thank you very much to all of you who have contributed very important inputs to this conference. We agree that we all want to be leaders and we want to lead. We need to start the leadership with ourselves to see that we actually create the change that we want to create. And I hope we are all committed to the gender lens that has also been mentioned. So we'll try and ensure that that is well accommodated and expounded on in the statement. And then the last one, which is around how we sustain the drains. To make it even louder and stronger, I would say how we protect the drains in terms of how the civil society works with the government. So we have taken note of all this input, and what we will do is to try and also shorten a bit the statement, the final statement that will be shared, so that we can have an effective statement that will be read by all those that we target. So thank you. And another round of applause to all those who have made these contributions. We'll now transition to the remarks, and we have just mentioned the important role of the civil society organizations. So we're going to have Dr. Lydia Mungerera, who is the CSO representative on the Health Policy Advisory Committee at the Ministry of Health, to give some remarks on behalf of the civil society organizations. Okay, there she is. You're welcome, please.
When I said that I'm coming with my team, everybody gets worried. And yet on the first day we were here, a group of us. So you know me, I'm very rebellious. Let me have my civil society members around me and I will make my comments. Civil society, where are you? I'm going to make the comments myself and I'm going to be very brief. Thank you. This is my backup. I think on the first day, the role of civil society was clearly mentioned. And I think every meeting we have gone to, we have talked about the role of civil society. But now we want to commit. We want to commit that in an integrated plan, civil society, we are prepared to work with you to make it happen. And I think these are the critical words that we want to speak here. We are very grateful we are represented on so many committees, but we want meaningful representation. And now we have the academicians in the room. You know me, dear, I speak in a different way. We have worked with Ministry of Health. They have involved us, academicians. And I'm looking at the academicians. Please work like this, the Ministry of Health and involve us. Even in planning, that you plan, involve us. But now I just wanted to also say that I think civil society on the ground, we are the watchdogs. And Ministry of Health, we have always told you we are watching you, but we want to watch the academicians as well. We are the watchdogs on the ground, we shall watch you, and we will not keep quiet. You know, for us, we are the noise makers. But you know, when we make noise, it doesn't get us away from partnership with you. We are going to partner with you to do for everything that we are doing integration. We have actually been integrating already. For us, we believe in the one plan, one budget, one monitoring and evaluation. We believe in that, and we shall work with you to make that happen. So I think so much has been said. I can see CSOs all over the declaration. We hope we are going to watch how this works out, and we shall always be there with you, working together with everybody, all the stakeholders as civil society, and you know us very well. Thank you so much for involving us. Thank you so much for this meeting, and we shall continue the partnership. Integration, we believe in it, and we shall make it work. All of us together. Thank you.
Thank you very much, Dr. Mungerera, on behalf of the civil society organizations, and furthering the theme on integration. We have had that as a very bold theme during the conference, and we are saying that beyond the integration that we discussed, we also need to further the integration of academia, civil society, the development partners, the policymakers, and really have a truly meaningful and multi-sectoral collaboration and coordination as we move forward. You're welcome to watch us, but also welcome to work very closely with us to achieve these commitments that we want to make. Thank you. So, as we proceed with the remarks, I need to mention that after the remarks by the principal, College of Health Sciences, who's been represented by the Dean, School of Public Health, we'll also have remarks by the World Health Organization country representative, who's being represented here by Dr. Elizabeth Magrambo. I hope I wrote that right. So just to notify you. But this year's conference has been spearheaded from the university side by the School of Public Health, and we are really glad to have our Dean, Professor Rhoda Wanyeze, with us here today. And she's also representing the principal of the College of Health Sciences, and I'll shortly invite her to give her remarks. But I also need to mention that we do these conferences spearheaded by one school from the broader College of Health Sciences and the School of Public Health every year. And after her remarks, we'll do a handover to the next host who is going to steer us forward to the second communicable and non-communicable diseases conference, together with the 20th Joint Annual Scientific Health Conference. So we'll do that handover, and by the time we leave here, we'll know who is going to spearhead the efforts of organizing this conference next year. So that said, I now want to welcome the Dean, Makerere University School of Public Health, to come and deliver her remarks, as well as represent the principal of the College of Health Sciences. Thank you.
Thank you, Rollins, and our chief guest, the PS, Dr. Diana Twine, and the rest of the management team of the Ministry of Health, the representative of WHO, and all the partners here present, all of you ladies and gentlemen in your respective capacities. It's such an honor and privilege for us to be together in such large numbers as we close this conference today. And also, as we hear the outcome of this conference in terms of the declaration that Professor David Musoke has just read to us, and also to hear again our commitments in terms of uniting to advance interventions jointly against communicable and non-communicable diseases so that we can improve the health outcomes of our people. As we come to an end, all of us need to reflect even deeper about all the incredible presentations, discussions, commitments, as well as the networking and engagement that we've all had over the past few days. The new science, evidence that you've had, innovations. What did you hear that is new? What is it that touched you in terms of how you do your work? What is it that touched you in terms of your own health? We also had emphasis about our individual commitments to be healthier, our individual commitments to be active, physically active, to watch what we eat, how much we eat, and several other lifestyle changes that we need to make. Professor Maswa has just called upon us, all of us, to be leaders if we are going to make a difference, and we cannot lead for healthier outcomes if we don't commit to be healthier ourselves. So I would say for all that we've had here today, we need to take time and reflect and create a change. Yesterday, I thought, I'm sitting too much, I need to get up and move. Because I had Professor Gua today say, you won't sit the whole day and you think you are going to compensate in the evening when you do one bout of 1 hour, because all those are individually demonstrated as risk factors for our poor health. So I've been thinking, maybe next time I have a conference, there's going to be moments for us to get up and walk around a bit. I don't know how we shall do it, but these are some of the commitments we need to have. We're going back to have meetings in our offices. Are we going to make people sit for 6 hours before we leave? Then we are part of creating sedentary lifestyles. So we need to reflect, what is it that we can change? There is so much, many low-hanging fruits at individual level, in our offices, and many other spaces where we are working. Some of us are really good at speaking and amplifying messages. Please speak more. Civil society, the media, we need to see more articles. Please follow up on the information that you've had here today. reach out to us. The organizers are here. You can contact us if you want more information from any of the presentations so that you can better educate our communities. So that commitment we need to take forward to our homes as well. We still remember Professor Maswa about life, good health being made at home, and that nice advert we used to hear. So let's take it home, in the workplace. Some of us spend more hours in the workplace than we do at home. And wherever you are, leadership of organizations, what interventions do we need to do differently? The theme is united. Sometimes we get out there and then we compete for work to do, and yet there's so many problems for us to solve. United against communicable and non-communicable diseases and health systems means that we need to work together. And that, for me, is one of the areas that I need to emphasize. Work on translation of the evidence that we know. What can we do differently jointly? Academicians, research institutions in the room, we made some commitments as well that we are going to do certain things differently in terms of the health workforce training to make sure that the people we send out are fit for purpose, but also to make sure that the evidence we generate can truly make a difference. But translation is a relay. It's not an act of only academicians. I hope we can all again unite to make sure that we use the evidence that we generate together. We need to also create advancements in terms of generating more evidence and innovations. Just as we've talked about what is new that we must do, we've also talked about what we don't know. And we need to be able to move that forward. We heard from the declaration that we need an agenda to inform the research that we are going to do and innovations as well. So as we live here, I feel energized that we are going to do things differently. At least I commit I will, and I need to say it here, so that if you see me sedentary, please step on my foot and get me going. But I do commit individually that it's my own space. I'll try to be healthier. I will encourage the people around me to be healthier, and I'll do better within the institution where I work. So thank you. I hope each of you will take a moment to make your own commitments. If I had a moment, I would have just said, can we say it loudly together, that I commit to do things differently? At least we can say that. Can we say that? I commit to do things differently at individual, at household, community, and my place of work. Thank you, and let's clap for ourselves for that commitment. Thank you, Ministry of Health, PS, and your team. Dr. Stavia Tuliahabu, she was very firm and persistent about the integration. When I first talked to her, she said, we must integrate. You see, we are integrating. You can't run a parallel conference and we are running another one. So we owe it to her for pushing for this. And the person that's leading this from the School of Public Health, Professor David Misoke, he's very good with collaboration and partnerships, and I had no doubt that he, together with Stavia and the rest of the team at the Ministry of Health, would make this happen. So we really do appreciate you both. And the rest of the teams that you've worked with, DG is not here, and all the other leadership, the contributors, the co-chairs, Dr. Kambugu and Professor Pauline Viachika. We saw here the abstracts team, Professor Moses Kamia and Rollins here. Thank you, thank you. I hope I've not left out any of the other key people, but we really, truly appreciate you. We appreciate the presenters for your wonderful evidence that you bring here. And as you do your research, as you move on, expect that next year you need to bring it. Thank you, all of you delegates here, the chairs, and thank you all the partners that have made a contribution to make this conference a success. I will now, yes, let's appreciate everyone. And then I will now hand over to Dr. Lawrence Indejo to work on the next process of handing over this next year's conference to the school that's going to coordinate it within the College of Health Sciences. School of Public Health and College of Health Sciences work closely together. And I did make my remarks on behalf of Professor Bruce Chirenga, as well as on my own behalf as the Dean of the School of Public Health. Thank you.
Okay, thank you very much, Professor Wanyenze, for inspiring us, but also leading us in the commitments and reminding us that leadership starts with us and at home. Thank you. So as I mentioned earlier, this is the time we are going to do the handover to the next school. The College of Health Sciences has several schools, including the School of Health Sciences, the School of Medicine, the School of Dentistry, Biomedical Sciences, etc. So the 20th Joint Annual Scientific and Health Conference will be led by the School of Medicine. So I want to invite a representative from the college management team. I don't know whether we have Dr. Khalid Rajab, who is a member of the college management team, together with the other members, the college human resource, quality assurance, grants manager, to come and receive the mantle from the Dean School of Public Health. So the handover is taking place from the School of Public Health to the School of Medicine. Thank you so much. And we are looking forward to the conference next year. Okay, thank you so much. Thank you so much. Okay, another photo, please. This is how democracy works, please. Okay, this is great, and a very good gender photo, if you can say that. Okay, so we'll now move forward. As I said earlier, we will have remarks now from the World Health Organization country representative, Dr. Elizabeth Madrambo, who is in charge of emergency preparedness and response. Please come and give your remarks.
The Permanent Secretary, Dr. Diana Atwine, the Ministry of Health officials here present, members of academia, partners who are represented here, the family of the late Dr. Matthew Lukwia, colleagues and fellow professionals, good evening. Good evening again. I know it's evening, but I hope we are still here. So today I'm speaking here on behalf of the WHO representative, Dr. Kasonde Mwinga. She was not able to make it, but allow me to first speak on my behalf. You know, sometimes when you arrive
and you get the reflections and all that, there's those reflections that go through your mind. When I saw the invitation to the lecture, the memorial lecture, first I wondered, why Dr. Matthew Lukwia? Then I started reading more about him. And I got to realize why. And I know as you've been here and you've listened, you've all been able also to see why, but I want to just give a snip chat of what came to my mind. And I want to link it with what Prof. Omaso said. Actually, when I was looking, I saw that he was a leader. He was everything, like he was there to sort things. And he was driven by the goal of saving lives. When I was reading the story, I was like, if it was today, I would say he was case management pillar lead, he organized for the isolation, and by the time teams were arriving on the ground, there was a fully running facility. He was in coordination. He did everything, including bringing partners together, reporting, the Ministry of Health. He was RCCE, risk communication. I read that when he realized that the harmful traditional practices were the drivers, he started mobilizing community against that. That means he was just looking at how do we solve this? And it was like issue after issue. And the other thing that amazed me, I read that him together with the head nurse, they sat the whole night to go through CDC and WHO reports on this disease, so that to be able to understand what is happening. Then after that, they were able to share that with the healthcare workers and with the communities to counter misinformation. Isn't that fabulous? If everyone in this room and our healthcare workers today will take the same approach, how far will we go? Because from what I see a man driven by the desire to save lives. And as has been said, that came from his last words, right? That if I die, let me be the last. And even when he was talking to the nurses who panicked and didn't have the strength to continue, he was able to talk to them and work alongside them so that they continue working. So for me, I take this as an inspiration to all of us. Even as we link it with the integration agenda that we've been discussing all along, I liked the call for all of us to be leaders. And that means as we go to reflect on how can we all be leaders, I think that is a fabulous story there to help us on how to all be leaders in matters concerning health. So I think that ran into my mind and I thought it's something worth sharing. And just to go into the remarks, again, it's a tribute and also an honor to this family and the lecture, the memorial in general. So I'm reading this on behalf of my representative. Now I've already spoken what I had in my heart. I'm happy I've spoken. Now I can read through because inside the speech I may not be able to put my words. So now assume I am Dr. Mwinga Kasonde. Now I'm reading on behalf of my WR. So I stand before you today, not only as the WHO representative in Uganda, but as someone deeply moved by the legacy of Dr. Matthew Lukwia. As you can see, many people are moved by this legacy. His story is not just something in the past, it's a living testament for courage, compassion, and sacrifice that define the profession. When I arrived in Uganda this January, not me, for me I arrived 2 years ago. When I arrived in Uganda this January, I was immediately thrust into the response to a Sudan virus disease outbreak. It was during this time that I first heard of Dr. Lukwia. From Dr. Mike Ryan, a hero in his own right. Dr. Mike Ryan is our former director, executive director of emergencies in the headquarters, Geneva. And he happened to have worked together with him during that outbreak in 2000 in Gulu. So he shared his experiences, how they worked together in the Ebola response at that time. So we all know the official details of the devastating outbreak, but what truly defined Dr. Lukuya was his character. A brilliant academic who returned home to serve his people. A leader who, in the face of fear, rallied his colleagues, not by commands, but with songs of solidarity. A doctor, in his final act of selflessness, isolated himself to protect others. And this has been said over and over, that his final words, this is something that moved many, that if I die, let me be the last one. So that is the kind of courage that transcends time. It is the sacrifice that continues to resonate through the lives of countless health workers who have answered the same call, and we hope that many more will continue answering the call. When we think of our health workers who became casualties of the 2022 outbreak Ebola, at least 7 died and 19 were infected. We also remember the nurse in Kampala, a health worker in Kampala, who was the first case in Uganda in the 2025 Ebola as well. And we also don't forget the same trends that has happened in many other countries, like in the Democratic Republic of Congo, where tragically at least 4 healthcare workers were among the diseased. These are not just statistics. They are nurses, they are doctors, they are support staff, they are spouses, parents, children, and friends. They don their scrubs and PPEs every day. They were driven by the unwavering commitment to heal and protect. So when we look at this, we want to say that WHO is really dedicated to ensuring that we build on the lessons of this outbreak, not only for the emergency, but also for the health sector as a whole. And we cannot simply honor Dr. Lukuya and the countless others with our memories and our mourning alone. That will not be enough. The fight against Ebola and other epidemics is not only about clinical response, it demands more. And again, from my earlier reflections, we also see the need to emulate that also in the other areas that we are serving in. So we would like to call on all of us to uphold solidarity and accountability, not only in the face of threats, but also when we are working in the different components that we serve in order to protect lives, in order to ensure accessibility to care, in order to save lives. Finally, the risks posed by emerging pathogens will not disappear. Let us ensure that our investments, our policies, and our collective actions will be focused on one clear goal, honoring the sacrifices that have been built in the past. So let us be moved by clear goals and let us work together towards ensuring that these goals are achieved. Let us bring all our expertise, let us bring all that we have on the table so that then we are able to make the country a safer place and to protect populations and to save lives. Thank you very much.
Thank you very much for those very powerful remarks. I'm glad that the theme of us committing and also leading the change that we want to see is continuing throughout the remarks. So ladies and gentlemen, we have 2 more remarks to go. So we'll then get to that very shortly. After the remarks, we'll do some closing photos. We'll also provide some certificates of recognition to those who have supported the conference in that sense. So I now want to take the opportunity to invite the remarks. I want to take the opportunity to invite Dr. Stavia Turiahabwe, who is the Commissioner of Communicable Diseases at the Ministry of Health, who is representing the Director General of Health Services, Ministry of Health, to come and give their remarks. And after your remarks, Dr. Stavia, I want to see you coming through. After your remarks, I will request you to invite our chief guest, the Permanent Secretary of the Ministry of Health, Dr. Diana Twine to give her remarks as well, and also officially close the conference, and then we get into some bit of certificates and photos. You're welcome, Dr. Stavia.
Thank you so much, our moderator, for this closing ceremony. Good evening to you all. You're very tired. Good evening to you all. Yes, I am very happy and excited that we have reached the final moment for our 5-day conference on communicable diseases and non-communicable diseases, together with the 19th Joint Health Scientific Conference. Our chief guest, Dr. Diana Twine, who is our very energetic and courageous, charismatic permanent secretary of Uganda that we have had. We are very happy that you are here with us till this moment, and for all the time that you joined us through the conference. But not only that, for supporting us, that we can have this conference with your leadership and the entire Ministry of Health top management. Thank you so much for being here. I want to thank Makerere University, the College of Health Sciences. You know, our chief guest, when you talk of integration, people have a lot of fear. When this first came up I think it was in the second or third planning meeting, one of the people that was participating said, but there is a joint scientific conference that we hold in the College of Health Sciences. Then we try to look around, who organizes this, who does what? Then we reached out to Rhoda, and she was very receptive. I want to thank you. You are a true leader of public health in our country. Thank you so much for accepting and for convincing the organizing committee to merge with the Ministry of Health organizing committee to have this conference realized. I want to thank the Ministry of Health departments, especially the non-communicable diseases department and other departments that allowed to work with us to give ideas on how we could make this conference happen. Thank you so much. I see some commissioners here. I want to recognize you, commissioners. I saw some of you again in the opening. I know we are very busy with many things, but you have taken off time also to be here and to support the entire conference. I bring you apologies from the Director General Health Services. He's very passionate about what is happening in this country today, but unfortunately the conference came when he was on duty outside Uganda. And Dr. Daniel Chabainze, the Director of Public Health, but also is the Acting Director General, was on his way to this closing ceremony, and he was summoned to go up country for an urgent issue to handle. The Director General was the chair for this organizing committee. I want to congratulate him in absentia that we have had top of the notch scientific committee of communicable and non-communicable diseases in our country. The first one joined with the 19th JASH. And also thank him for his technical leadership in making sure that this happens. I've seen the Makerere team has handed over leadership to the next school. I think, Madam PS, now for you, we shall hand over to the next department. You select the department. You select the department that will lead us in the 2026 Communicable and Non-Communicable Diseases Conference. We want to leave the integration This is not a business of one or two people in the ministry. It should be everybody's business. You will realize that when we came together, we have been able to pull off this conference because of collective effort. You can imagine the synergies that we have created. The academia has advantages that we don't have in the Ministry of Health. And they have been able to support quite a number of things to run as smoothly as you have seen. So the integration has its good side. If you open your mind and embrace it and provide the leadership that it requires, we'll be able to see more with less. No wonder we have now less resources. We no longer have the luxury of a lot of funding. So I want to welcome all of you to think of people-centered approach and integration. The next conference we are thinking could be in October. Because of combining with the universities, November they are in exams, and we want to bring on board more universities. They are preparing to begin exams. We actually had to pull it from end of November to early November. So it's either going to be in the first week of November always, or we pull it into October. But we will communicate once we align with the Makerere School of Medicine. Because of time, I will not add many other things. Allow me to appreciate you, participants. Thank you so much for staying with us. I moved and checked all breakaway rooms. Each room would be full. Each room would be full. The plenary sessions. Thank you for being there and for being attentive. I hope we have learned and picked the best practices that we wanted to pick. But also the declaration that we have just read. Thank you for bringing out those ideas. This is your output, and we all own it. I also note that we have been able to pick key recommendations and key messages, like you've been seeing in every morning feedback or recap. So thank you for those key messages and actions that you shared. I want to thank our sponsors. Without you, this would not have happened. Join me to clap for our sponsors. When we started, initially we thought we were going to go with only the private sector, but it also so happened that the private sector was also in some level of turmoil, some of them because of what happened globally. But a number of them still stood with us, and we thank you for that. And we call upon you that you prepare for 2026 so that we do better. I want to thank organizations that sponsored participants. Thank you so much, all of you, you know yourselves. I want to thank the Ministry of Health for availing resources to support this conference, and in a special way, the organizing committees. You all know, at least the organizing committees know, that I took off some time towards, I think, beginning of this month, but I was sure that the chair, who is the Director General Health Services, and the co-chairs, Dr. Andrew Kambugu, the Professor Pauline of Mbarara University, and Dr. Musoke here, were going to push this together with the support of the committee. I know the logistics committee was the hard hit because of the way we were pulling resources from here and there. But thank you, the chair, who is Kenneth Akira, our undersecretary. Thank you, Robert. And thank you, Ruth, Maureen, and the entire team in the ministry. Thank you, Commissioner Non-Communicable Diseases. Thank you, Commissioner Lab. whom I left, and Assistant Commissioner Dr. Robert Mutumba for making sure that preparations went on well. Yes, we must provide the leadership, and this we must provide it in the time that we are in and the space that we are being placed in. We have no other time. Thank you so much. Have lovely travels as we depart. It is now my singular honor and pleasure to invite our permanent secretary, who is the chief guest, to give a closing remark to the conference. Thank you.
Distinguished delegates, esteemed guests, partners, colleagues, I want to take this opportunity to congratulate you to come to the end of this conference. And I take note of the recommendations that have been highlighted earlier. And I want to congratulate again, to add my voice to the people who have been actively participating. First of all, the paper, the abstracts that were submitted and the presentations that have been made that have enriched the conference. I want to appreciate in a special way the people that have shared, have taken time to, like keynote speakers. I also want to add my voice to the previous speakers on appreciating the organizers of this conference. So allow me just to conclude, because I'm not going to repeat what has been said. I know people are tired. You've been sitting here you are very tired. I don't need to repeat whatever has been said, but even if I don't say much, conclude by saying 5 things, at least of all the things, at least you remember 5. Only 5, I'm not adding anything. The first one, we are called, all of us, to innovate. And innovate is in line with what Professor Mas was saying about leadership. At any one time, if we are leaders and we are confronted by all these challenges in health, because I know that we have high disease burden, you've talked about all these problems. Antimicrobial resistance is another monster in the house. We know that we have frequent epidemics in the country that keep on coming and put our systems on its knees. We have limited resources, even when government is being called upon, and we are also committing as government to make sure that we pull resources. But we know that Uganda is very high with its high fertility. The growth rate that is not matching with the resources, it is going to continue to be a challenge. So with all that, with all those things that are confronting us, we are supposed to be leaders. We are supposed to exercise real leadership. Real leadership means that you must find solution. Because things will always come. So we are called upon, all of us, to innovate. We're not talking about, going to the hub, this innovation. We are talking about, we are telling you that wherever you are, if you are director of a hospital, if you are if you're working with an agency, if you're teaching in an institution, you must innovate to the things that challenge us in our environment, especially that is concerned lifestyle challenges. Innovate. Number 2, inculcate a culture. I'm talking about five eyes. So 5 eyes. So inculcate a culture, mindset change, meaning that health will begin with me. And I think Rhoda talked where all of us have to start with ourselves, to start with our families, we start with our department, to start our institutions. How can we change the culture? How can we inculcate a culture of transformation, of mindset change, of quality, of results, of hard work, of growth, of improvement? How can we inculcate that culture? It begins with us in this room. It's not going to begin with somebody else. It begins with us here. Just follow what we've been discussing here. If you're a man of 50, go and check. If you're a woman, go and check. Know your status. Have lifestyle change. If you know enjoying pork and what and all, and you know your BMI is going higher, please go back and say, I must change. I must really, this time around, I must deal with my health as an example, so that even my children learn from me, my wife learns from me, my people I work with must learn from me. So we must inculcate a culture of mindset change, beginning with ourselves. Number 3, it has been the theme of this conference, integrate. We no longer want to see verticalization. We have had verticalized programs. We have had verticalized things. We must break down the walls and we must integrate. And in the integration, we must be mindful, must be intentional that whatever we are doing in this integration, it's not just to say, oh, you know, Ministry of Health, let us integrate. No, we must integrate because it is the right thing to do. It is bringing efficiency. We are going to see some effective implementation, and we cause transformation. That is the ultimate goal. So integrate. We continue as government to explore means of resource mobilization. So we are going to continue to invest smartly, not just invest. Even in our respective institutions, whatever we in our planning, our budgeting, our implementation, we must reach in impact, high impact that are going to help us to transform the sector. Not just routine, not just copy and paste, and you know that's how even this year. We must invest smart. We must find a way of getting resources, alternative resources. I know that I believe while you are here, you discussed on national health insurance and other alternative financing that can help us really to make, and I've seen the resolution here, that we need to increase the funding. But the funding can only be possible and be meaningful if we invest smartly to get results. Lastly, Ugandans, we are used to making policies. What we are so good in guidelines and policies and strategies and protocols. We are so good. Now, after saying that, can I call upon you, all of us here in this room, that we implement, put that in capital letters, implement. Because resolutions, we make really resolution, print very nice, well-designed protocols and guidelines and work plans. Really nice. Now, agree that the era of thinking for other people, making policies for other people, and when we go and implement and we let other people and enjoy our documents we have developed and go and implement very effectively. Can we now say we should? Those resolutions we have agreed there. Even I've heard they are called Munyonyo declarations, Kampala declarations. Yeah, you call them whatever you want to call them, but they are declarations. So can we now say we are going to, can we all of us say, implement? Thank you very much. And with those words, allow me to thank you once again for coming. And I thank you all for your active participation. I now officially declare officially closed. Thank you very much.
Yes. Yeah, I want to do the certificates.
There are many, you call one and the others can come and
We
stand
don't
for a
want to
moment.
for the organizations. I wanted to start with Dr. CTMP, who has plates for the panelists of the Dr. Matthew Lutria Memorial.
Read quickly, they will come and stand up, and then we'll anthems after questions.
So Dr. Earlier, we are going to give out certificates of supported organization of this conference. So, as they and take comfort, if this start with the plates for the panelists of the Dr. Matthew Lutria Memorial Lecture. Dr. Sechempe, please come and guide us through that very quickly. I want to request the Commissioner, Dr. Stavia, to come and receive them. Then you'll hand them over to the Permanent Secretary, who will then give it to those who will be read here. The other panelists here, we can make a line here and at least shake hands to with those who are receiving these accolades today.
So the first one is Dr. Andrew Kamgu, who was the moderator of the Matthew Lutria panel discussion. Then Dr. Solomon Okware. Miss Victoria Navankema. Dr. Misach. Dr. Misach, please. Then Susan Navada. Please stay on the stage. Dr. Navada. Then Dr. Lamode from Nigeria. So that is our contribution from UNACO, who organized this conference together with the WHO and the rest of the JUST team. Thank you very much.
Okay, so we can have a group photo. You can do. Okay. Thank you so much. So we're doing the last round, this time for our partners and sponsors. And I want to read them very quickly, so please prepare and come through quickly so that you can have a photo moment with the Permanent Secretary, Ministry of Health. So can we start with the College of Health Sciences, Makerere University? Representative? Okay. We can then... Okay. The certificate for the College of Health Sciences has been received. Choir AI, Infectious Disease Institute. Dr. Kambogo, if you want to come back, please. Cepheid. Deft Imaging Systems. Japaigo. Japaigo, are you here? AHF Uganda Cares. Walimu. Mother to Mother. Malaria Consortium, please keep coming. We need to summarize this.
This is HF. No.
Malaria Consortium, are you somewhere?
Mothers.
Mother to Mother is here. Chai Clinton Health Access Initiative, PATH Uganda, Gavi, MRC Medical Research Council, TASO, the AIDS Support Organization, UNICEF, please come for a certificate. UNACO, Uganda National Association of Community and Occupational Health, Dr. Sachimpi, or a representative. Mbarara University of Science and Technology, we appreciate you. Please come and receive the certificate. The School of Biomedical Sciences, Makerere University.
Yes. Mbarara University is still here.
Mbarara University, anyone? No, we don't have those ones here. School of Biomedical Sciences, School of Medicine, please come for these certificates. The Ministry of Health. Dr. Stavia, who is going to receive this? I think she has it. She has it.
School of Medicine.
And then the last one, School of Public Health, Makerere University. We have certificates for the organizing committee. You'll be able to receive those. We won't read them here. We appreciate you. You'll receive those later. And we appreciate all those who have contributed to this conference in various ways. So we don't have a final group photo, but before that, I want to request one more photo for the volunteers, especially those who have been contributing to the rapporteuring, the ushers, those who have been in the different rooms supporting. If you can come here quickly, we have one final photo. And then after that, we'll have a final photo and the closing anthem. Okay. Okay, so okay. So, I'm joining. Okay, so can you please come for this photo? And when you come, you do not leave. Please come behind this way. The young people who have been supporting the conference, please come for your photo. Okay, so we are getting done with this photo. We also want to request for a photo with the family of Dr. Matthew Lukwia. That will be next. Dr. Matthew Lukwia's family, please come and join for a photo moment. Okay, so we're almost done with this. The photo, please extend this way so that it's. Okay. And then we are moving to the youngest people in the room. They are on our right here. Please come, the Gen Zs. Join down. Wait a bit. First, hold on. Okay. Now the Gen Zs, please join the photo. So we can have the Gen Zs, please join the photo.
Okay.
Thank you. You can stay. We request that you stay standing. You can stay. Colleagues, we request that we all stand up as we wind up. Local government leaders, the chairpersons, the district chairpersons, chief administrative officers, we have an opportunity to join. Please come forward. If there is space, I see Flavia is also asking, you can run and come here for civil society, regional hospital directors, commissioners, management, Ministry of Health, Dr. Mtumba and the team. You will all stay on the stage. Hospital directors, Dr. Patrick, Dr. Baizi, join in for the photo. Okay, I think that's it. So our chief guest will request that we all stay on stage in the same position, and we shall have the anthems that will officially end this. We shall have the anthem starting with the East African anthem and then the national anthem. Can you please pay attention for the anthems? The IT team, please. Thank you. See you again next year. God bless you all. God bless Uganda.
Okay.
In case someone left behind a laptop charger, if someone left behind a laptop charger yesterday in the breakout sessions, please, you will see the organizing team.
Okay. That's enough. Maybe you make it like this. Jimmy. Hello. Help me.